Dr. Kyle with Ice Clinics, bringing you your next tip for Tuesday. What we're going to cover today is a diagnosis known as Pronator Teres syndrome. Pronator Teres is a muscle in the forearm that most people haven't heard about, but should be very aware of, because when it becomes overactive, it can mimic symptoms of thoracic outlet syndrome, which we've done videos on before, and carpal tunnel syndrome, which we've also done videos on before. So just so you understand how this muscle works, the way it attaches is up here in our arm and crosses over down here onto our radius. And when it contracts, it makes your hand and arm go into this position. Now, if you think about this from a practical standpoint, how many of us are sitting in a position where, especially our right hand is like this, maybe clicking on a mouse or typing on a keyboard all day long? You can see how this muscle over the course of time can shorten. And the problem is there's a muscle that there's a nerve that travels under and through that muscle that can become irritated, known as your median nerve. And that is what mimics the symptoms of carpal tunnel syndrome. So if you have tingling, numbness, weakness of grip in your hand, it's not always guaranteed to start here, up here, but sometimes can be in the elbow, or sometimes can be in multiple spots. So the tip for recognizing if this might be an issue for you is to do a quick little exercise that kind of reverses this posture. So again, typically when a tight pronator teres muscle manifests, it kind of turns our arm into this position. So very practically, we just need to think in terms of turning it into what's called supination, and then straightening our arm as much as we can. Now, some of you guys know this rubber band is my favorite little tool to use for exercises, and I've shown you guys this exercise before to work all of the musculature on the backside of our forearm. But what you can do with this rubber band is also start off in a pronated position with your elbow bent, turn into a supination pattern, open your hand up, and then bring your arm into a straightened position. And this is literally addressing the exact reversal of what we were talking about with over tightness of that pronator teres muscle. So again, very easy exercise. You start off with your arm in this position, turn, open up, straighten arm, and kind of point backwards. Do a couple repetitions of that. That will not only stretch out that muscle, but help to strengthen out the musculature that will make this so it's not a problem in the future for you. Again, my name is Dr. Kyle with Ice Clinics. Thanks for watching.